In this video, we are going to discuss about Norma lateralis. So if you see, this is the lateral side of the skull. So what bones you are mainly seeing? So the first bone if you we see on lateral side of skull is frontal bone, and next comes the parietal bone, and next the occipital bone, and the temporal squamous part of temporal bone, and you will see the sphenoid bone. Actually, this is a greater wing of the sphenoid bone. Okay, and also you will see the zygomatic bone. This one is a zygomatic bone, and you will see the mandible, and of course maxilla, and finally nasal bone. So if you see them in total, we have seen 9 bones on the lateral view of the skull. So we need to see one more important feature on this normal lateralis view is the temporal lines. There are two temporal lines. The first one is the superior temporal line, and the next one is the inferior temporal line. If you observe the root of inferior temporal line, the inferior temporal line is continuous as supramastoid crest. You can see here, this is the supramastoid crest, which is continuous here with the zygomatic arch of the temporal bone. So this is a supramastoid crest. So this inferior temporal line will be continuous as the supramastoid crest. Okay. And one more thing we need to see is about the zygomatic arch or zygoma. So this is called as zygomatic arch or zygoma, and this is like a horizontal bar which is present in front of ear. So you can see this is the external acoustic meatus. It is nothing but away to the ear. So in front of ear you can see an arch that is called as zygomatic arch or zygoma. It is in horizontal bar-like structure. So if you see the zygoma, it is made up of the zygomatic process of temporal bone and the temporal process of zygomatic bone. So by these two bones, so once again let me repeat, this is the zygomatic process of temporal bone, and this is the temporal process of zygomatic bone. So this is nothing but the union of the zygomatic and temporal bone to form this zygomatic arch. Okay. In between these two bones, you can see one suture, that is the zygomatico temporal suture. Okay, so zygomatico temporal suture. So if you see above this zygomatic arch, this is called as temporal fossa, and in this temporal fossa there is temporalis muscle. So below this there is a masseter muscle. So these two muscles are present here. And if you see the lateral part, the lateral surface of this zygoma, especially if you see anteriorly here, this point is called as jugular point. Okay, this is called as jugal point. And this zygoma is having two roots. One is anterior root, one is posterior root. So if you observe the inferior border of this zygoma, you can see an articular tubercle, and back to the articular tubercle you can see one more bony projection, and this is called as postglenoid tubercle. So this is the articular tubercle and this is the postglenoid tubercle. Okay, now let us see a suprametal triangle. Actually the suprametal triangle is located here. It's a triangle like structure. So for the suprametal triangle, it is also called as triangle of Macqueen, and this is a depression which is seen actually in posterior superior to meatus. So this is meatus, so it is seen actually posteriorly. Okay, and above it is having a supramastoid crest, and in front by posterior superior margin of external meatus, and behind by a vertical tangent to posterior margin of meatus. Okay, so next we'll discuss about the Ashterion. You can see here Ashterion. Ashterion is actually a meeting point between the parieto-mastoid. So you can see this is mastoid, this is parietal bone. So this suture, parieto-mastoid suture will meet here, and occipito-mastoid, that is between occipital and mastoid. This one occipito-mastoid will meet here, and also there is lambdoid suture. So you know this is lambdoid. So all these sutures, three sutures are meeting here. This is a meeting point of sutures, and in infants the asterion is a site of posterior lateral or mastoid fontanelle, posterior lateral or mastoid fontanelle, which closes by 12 months in infants. Okay, now let us see mastoid foramen. Actually this in this mastoid process you will have a foramen, that is the mastoid foramen. And also you can see here the styloid process, which can be also seen on the lateral norma lateralis. Okay, and now let us discuss about pterion. So you can see here this point is called pterion. So front side you have pterion, back side you have Ashterion. So pterion is a connection of the frontal bone, parietal bone, squamous part of temporal bone, and also the greater wing of sphenoid. So all these structures meet together here and form a pterion. Okay, and now we'll see this pterion point is also called as Sylvian point. Okay, now let us see the clinical anatomy to this pterion. Actually, in any roadside accidents, the anterior division of middle meningeal artery will rupture here, and this will lead to clot formation. So you can check out that diagram for this clinical anatomy, where there is a clot between the skull bone and the dura mater or extradural hemorrhage. This is called as extradural hemorrhage. The clot compresses the motor area of brain, leading to paralysis of opposite side, and the clot must be sucked out at earliest by trephining, and the head must be protected by helmet. So that's why they'll say head should be protected by helmet. This is an extradural hemorrhage. Okay, so this is the last part which we need to see regarding the norma lateralis, that is the structures which are passing through this foramina. Tympanomastoid fissure on anterior aspect of base of mastoid process. Tympanomastoid, between the tympanic and the mastoid there is a fissure which is on anterior aspect of base of mastoid process, and it transmits the auricular branch of vagus nerve. Okay, and the mastoid foramen, in the mastoid there is a foramen which transmits an emissary vein and connecting the which is connecting the sigmoid sinus with posterior auricular vein, and there is a meningeal branch of occipital artery passing through mastoid foramen. So finally, zygomatico temporal foramen, it is present actually in the zygomatic arch of temporal bone. Okay, it transmits the nerve of same name and a minute artery. So this is all about the norma lateralis.